So what I'll try and do in the next 10 minutes, it's sort of outline the impact of the lessons learned during the last public health emergency we had. So that's the Ebola epidemic. And during that time, I was actually a professor in Liverpool School of Tropical Medicine, and I had PhD students in Liberia and Sierra Leone. So I was very familiar with the situation there. And now we have COVID-19, the other big public health emergency. And also being part of EDCTP, we've been involved a lot in supporting scientists in Africa on how to address this. So I think this is a good opportunity to try and answer some of the questions that previous speakers have alluded to. For instance, how do we engage with the changes that we are seeing? And how do we engage with a crisis in terms of implementing responsible research? And how has Africa been able to embrace open science, and what have we learned since? So I think, again, the whole thing, if we look at what happened during 2014 to 2016, I mean, this was a very deadly disease. It was not, the R0 was not as high as in the case at the moment. So, but we had over 11,000 deaths. So far in Africa, we have less than 4,000 deaths from COVID-19. But then Ebola was a public health emergency of international importance, just as we have COVID-19 today. Now, in terms of, we have to see the capacity, look at the capacity of the countries that were affected by Ebola: Sierra Leone, Liberia, and Guinea, and to some extent, there were limited cases in Nigeria, and in Senegal, and in Mali. And so, but what is characteristic of these countries, the countries that were mainly affected, was that they had very limited capacity to perform research in biomedical sciences. And as was alluded to previously by Professor Matei, I mean, they had to their experience in Sierra Leone was that during this crisis in Sierra Leone, there was not even a functional national institution that could perform a PCR assay. And also, so during that time, the emphasis a lot, I mean, most of the research in Africa, especially in the Mano Riverine countries, was driven by researchers by the global north, and it was a lot focused on publishing papers in high impact journals, and so results were not shared early enough, and because everybody wanted to hold the cards close to the chest so that they can have a paper in science. As we can see here, soon a paper in science appeared in 2014 with a lot of authors, some authors from Sierra Leone and from the West African region, but it was driven and written, and everything was managed by the collaborators from the global north. And also, so here again, we're talking about big papers, referring to work in countries like Sierra Leone, but very little participation from the scientists in these countries. So what has changed in the last 5 years? And now that we have the COVID-19 pandemic, I just wanted to share a little bit for some timelines here so that we can compare that to what is happening presently. So December 12, symptoms appeared in Wuhan, but the virus was identified in January 17. And about 2 weeks later, the sequence of the virus was shared by WHO. Now, the relevance of that will come through later. And then on February 27th, it appeared in Nigeria. And what is important about the Nigeria situation, it was the first time for the first country to sequence the virus. But what is interesting was that this time, as opposed to what was happening during the Ebola crisis, everything was done by African institutions, led by Africans, with hardly any collaboration with the global north. So the African institutions had really moved a lot. And leading this one, especially with Nigeria, was the African Center for Excellence for Genomics of Infectious Disease. And it's really amazing what happened there. So the virus was confirmed, the first case on 27th of February, and a few days later, a specimen was taken to one of the institutes, but within 4 days, the genome sequencing was completed and the sequence was shared immediately. So we see what has happened in terms of the change in the last, from Ebola situation to African situation, the growth in capacity, collaboration between national institutions, and the willingness to share the data immediately. So even though this was a really good result, the first time in Africa, good sequencing, but did not wait for it to publish before sharing the results. And I mean, this is again just alluding to how quickly that happened, and the fact that it was shared before they were focusing on publications. Now, so, but before I do to that, so but Nigeria was not the only country that was able to do this nationally, and national scientists leading it. A lot of other countries, Egypt, Gambia, Ghana, Nigeria, Senegal, South Africa, Tunisia, and Uganda, they've all done this, sequencing the COVID-19 virus with the national capacity they've got. I think it was only Algeria that had to send samples to France for it to be sequenced. But all these institutions, and if you can see some of the institutions that have done really well in terms of the speed and the capacity to do this genomics analysis, they're mostly from West Africa, the Gambia, Ghana, Nigeria, Senegal. But also, if we look at DRC, this was a country, it is a country with not a strong capacity in terms of biomedical research. But because of the experience with Ebola and the amount of effort, and this has been done a lot between global collaborations that led to that, but DRC was also where local institutions were able to sequence the virus. So it's now like, what happened then after that? So after 2016, the Africa Center for Disease Control and Prevention was established. I think this has been a really good institution in terms of coordinating and also strengthening capacities in the national public health laboratories that they manage. And also, during that time, a lot of other things happened. I mean, the European Commission committed a lot of money to public health emergency research. I mean, immediately after that, EDCTP had to open a special call so that they can support a capacity for research on Ebola in West Africa. And also, we've just completed a call now to also support similarly research for COVID-19 in Africa. But also, in 2016, the Nigeria Center for Disease Control had not even been a legal entity yet. So that's been established now. And a lot of countries after that had really been focusing now on the value of genomics. And then so the SAMRC, which is hosting EDCTP here, has now got a genome center to bring affordable whole genome sequencing to Africa. So a lot has happened since the Ebola outbreak. What is interesting is that a lot of African institutions are really keen to learn about this evolution. And so recently, I published a paper in The Conversation just expressing this. And you can see the level of interest in it. So this was published first week of April. It has now had nearly 14,000 views, 114 tweets, and 783 shares on Facebook. This is how interested people are in trying to learn how this capacity for biomedical research has evolved in the last 5 years, and how Africa has really matured, and how Africa is now in the driving seat, leading this, and also how Africa has embraced open science. So it is now happy to share this important data even before it can think about publishing this. So I just wanted to share this important evolution that has happened, mainly starting with seeing strong global collaborations, but with African scientists grabbing that and moving things forward. Thank you.